He told me he hadn't cried since he was 9 years old. Said it like it was something to be proud of. And then I uncapped the syringe and his whole face just shifted. Like a door swinging open that he'd forgotten had hinges. I want to tell you about Marcus. It was a late summer evening, the kind where the air outside still holds the heat of the afternoon, but the clinic has gone quiet and cool, and the fluorescent lights hum just a little too loudly because there's nothing else to compete with them. Most of the staff had gone home. I was finishing up a double shift, my second cup of cold coffee sitting on the counter, completely forgotten, when the front desk called back and said, "There's a walk-in. Says it's not an emergency, but he looks like he might pass out in the waiting room." I went out to get him. He was tall. The kind of tall that makes small rooms feel smaller. Somewhere in his mid-30s, I'd guess. Broad shoulders, work-roughened hands. The kind of guy who probably fixes things around the house on weekends and doesn't make a big deal about it. He was sitting in the plastic chair with his elbows on his knees and his eyes on the floor. And when I said his name, he looked up, and I saw it immediately. Pure, undiluted, absolutely ancient fear. Not of me, of what I was about to do. "Marcus?" I said again, softer this time. "Yeah." He stood up too fast and had to catch himself on the armrest. "Sorry, I'm fine." He was not fine. I brought him back to the exam room and he sat on the table and the paper crinkled under him, and he winced at the sound like it had personally offended him. His doctor had called in a prescription, a course of intramuscular antibiotics for an infection that had been dragging on too long. His regular clinic was closed. He'd driven 45 minutes to get here, and the whole way, he told me, he'd been trying to talk himself out of it. "I almost turned around twice," he said. "But you didn't," I said. "My wife would have killed me if I had." I smiled. "Smart woman." He laughed, just a little. And that laugh, that small, reluctant laugh, was the first crack in the armor. I've learned to watch for those. The moment someone stops performing bravery and just becomes a person sitting on a crinkly paper table under 2 bright lights, a little bit afraid and a little bit relieved that someone noticed. I pulled on my gloves, that soft snap of nitrile, which I've always found oddly satisfying, and started laying out what I needed. I do it slowly, deliberately, not because I'm stalling, but because I've found that letting someone watch the preparation helps. It demystifies things. The syringe, the vial, the alcohol swab in its little foil packet, everything visible, everything ordinary. "You want me to explain what I'm doing as I go?" I asked. He looked at the ceiling. "Will it help?" "Honestly, for most people, yes." "Then sure, why not?" So I talked him through it. The medication was going into the gluteus medius, one of the muscles in the upper outer hip, which is the standard site for intramuscular injections in adults. It's chosen for good reason. It's away from major nerves and blood vessels, it's well muscled in most people, and it absorbs medication reliably. I asked him to stand and shift his weight onto the opposite leg from the injection site, the leg I wasn't working on. That relaxes the muscle, I explained. A tense muscle hurts more, resists more, bruises more. You want it soft, receptive almost. Like trying to push a pin into a pillow versus a board, I said. He considered this. Okay, that actually makes sense. I located the site, the upper outer quadrant, found by feel as much as by sight, using the landmarks of the hip bone and the curve of the muscle beneath my gloved fingers. I've done this enough times that my hands know what they're looking for before my brain fully articulates it. There's something almost meditative about that. The way knowledge lives in your hands. I cleaned the skin with the alcohol swab in a small circle, outward from the center. Waited a few seconds for it to dry. This matters more than people think. Wet alcohol stings. Dry alcohol is just cool. Take a slow breath in, I said, and let it out easy. He did. I inserted the needle at a 90-degree angle, smooth, confident, not hesitant. Hesitation is what causes pain. The needle doesn't know you're nervous, but the muscle does. You go in like you belong there, and usually the body accepts it. He made a sound, not quite a gasp, more like a small, surprised exhale. "That's it?" he said. "That's it?" I drew back the plunger slightly, just a small check to confirm I wasn't in a blood vessel, which is standard practice before injecting any intramuscular medication. No blood. Good. I depressed the plunger slowly, steadily, not rushed. The medication needs time to disperse into the tissue. Too fast and it aches, pools, protests. "You're doing great," I said, and I meant it. There's real courage in showing up for something you're afraid of. I don't take that lightly. When I withdrew the needle, I pressed a clean gauze pad to the site and held light pressure. Just a moment, just enough. Then I capped the needle without recapping by hand, disposed of it safely, and peeled off my gloves. He turned around and looked at me with an expression I can only describe as betrayed by his own fear. "That was nothing," he said. "It usually is," I said. "The waiting is the hard part." He sat back down on the table and we talked for a few minutes while I made sure he wasn't feeling dizzy or lightheaded, both of which can happen after an injection, not from the medication itself, but from the anxiety, the held breath, the sudden release of tension. Vasovagal response, it's called. The body's way of saying it was more stressed than it let on. I always watch for it, a sudden pallor, a glassy look, someone going quiet in a particular way. If it happens, you have them sit or lie down, elevate their legs slightly, and give it a few minutes. It passes. It almost always passes. Marcus was fine. Color stayed good, breathing slowed back to normal. "You have to come back in 2 days for the next dose," I told him. He groaned. "You'll be faster getting here," I said. "You won't almost turn around." He looked at me for a second, and there was something in it. Not flirtation exactly, just that particular warmth that passes between people when one of them has seen the other afraid and didn't make it a thing. Gratitude, maybe. Recognition. "My wife is going to want to know your name," he said. "To thank you." "Tell her it was nothing," I said. "Tell her you were very brave." He laughed again, fuller this time, real, and I handed him his aftercare sheet and walked him to the door. The clinic was quiet again. My cold coffee was still on the counter. The fluorescent lights were still humming. I stood there for a moment, gloves in the trash, the small ritual complete, and I thought about what it means to hold someone's fear in your hands for 60 seconds and give it back to them lighter. That's the part they don't really teach you in school. Some things you just learn by staying in the room.